All right, hello everyone, and welcome to our monthly OrthoCarolina webinar. The content of this presentation will be live streamed on our various social media platforms. My name is Chris Gabriel. I'm a physical therapist at the OrthoCarolina Sports Training Center in Matthews. Topic of today's presentation is ACL injury prevention and neuromuscular retraining. So this topic is near and dear to me. Every day I treat injured athletes all day. And it's really a big healthcare problem in our country and around the world. Depending on what source you look at, there's anywhere 200,000 or more ACL reconstructions performed every year in the United States alone. Healthcare costs exceed $2 billion, and our female athletes are anywhere from 2 to 8 times more likely to have an ACL injury than males. Even though we see a lot of traumatic contact injuries, most of these injuries are more subtle. They're more of a pivot, a twist, maybe landing wrong. And around 70% of these actually involve no contact at all. So what can we do to prevent these injuries? There's many risk factors that are non-modifiable, meaning that we can't do anything about them. A lot of it involves the athlete's specific anatomy. Sometimes how their bony skeleton is put together predisposes them to injuries. And especially for our female athletes, a monthly hormonal fluctuation during their cycle can cause a lot of increased risk as well. What we try to focus on is the modifiable risk factors, things like playing surface, footwear, issues with body mass index. And those of us in the rehab community, we really try to focus on neuromuscular factors, things like how the athlete is jumping and landing, how they cut, pivot, twist, change direction on the field. Those are the ways we can really make a change in this area. So with today's presentation, I want to just give a general overview of some various injury prevention programs that are out there and discuss some of the most important elements to include in a successful program. We'll go through a few screening procedures and assessments we like to use in the clinic, and I'll also give some demonstrations of some drills that we like to use and that are commonly seen in the injury prevention programs. And finally, we'll touch a little bit on the importance of wearing the proper footwear for the type of playing surface you're on. So what is an injury prevention program? It can be seen as part of normal training, but for the most part, injury prevention programs are used as a dynamic warm-up before the athlete practices or has a game. They're designed to decrease injury risk, improve agility and performance, and to prepare the athlete for a game or practice. We try to keep the length short, maybe around 20 minutes, and we like to focus on proper technique, fundamentals, and performance. This is a clinical practice guideline that came out in the Journal of Orthopedic and Sports Physical Therapy just last year. And after synthesizing a lot of evidence, they came to the conclusion that strong evidence suggests that clinicians should implement exercise-based injury prevention programs. These programs should include various components such as strength, plyometrics, and proximal control exercises. You can think of this as hip and core strengthening. It's very important we do these programs multiple times a week, anywhere from 2 to 3 times a week. Programs should last about 20 minutes, and it's very important that we do these both pre-season and continue it during the season. And finally, compliance and feedback are really important. The best injury program in the world isn't going to help unless it's done consistently. So this is a partial list that came from that clinical practice guideline of a few of the major programs that exist around the country and around the world. The next slide is programs that were specifically highlighted for specifically ACL injury prevention. If you look at those lists, the PEP program and the FIFA 11 Plus are probably the most commonly used and probably the ones you may have heard of. There's a lot of great information online that's free to the public, anywhere from complete training manuals that'll really help you understand good versus poor movement patterns, and there's a lot of free videos as well. So this information is really readily available. FIFA 11 Plus also has a program specifically tailored to the younger athletes. So if you have kids in this age range or coach youth sports, there are some modifications that are included to highlight specific needs that they might need some retraining on. This is a big research study that came out. It's a systematic review of randomized controlled trials, and it found that injury prevention programs have the potential to decrease injury risk by 53%. And again, it highlights those 3 categories we talked about before, but they did find that no one injury program was necessarily better than another. So as long as you're choosing exercises from each of those three categories, it can be very successful. So coaches and trainers can tailor it to their specific population. So just as a point of review, the most important aspects are strength, plyometrics, think jump and land training, agility, and feedback on proper techniques. We do see some programs include aspects of balance and flexibility, but it's probably not as important as those other categories. So if you are pressed for time, if you have issues with athlete compliance, maybe balance and flexibility isn't quite as important. I'll now go through a few assessments and screens we like to use in the clinic. These can be done with very little equipment, pretty easy to do, so you can incorporate with different athletic populations. First is just a quadrant jump. We're going to ask the athlete to jump back and forth in different directions through a 4-square kind of pattern. We're going to watch how they jump and land. Do they keep their knees nice and aligned as we see, or do they let their knees buckle inward? And then we can also kind of do it one leg at a time, where we can compare if there's any differences right to left. This is the landing error scoring system. This was originally developed to be a laboratory test, and they looked at 17 different aspects of how the athletes jumped and landed and correlated that with injury risk. Being a laboratory test, it's fairly time consuming. It requires 2 video cameras to do the analysis, and it's just not very practical to be used on the field or in the clinical setting. So what we use a lot is the iLESS. It's a more updated version. It's much more quick. It does not require as much time to implement. It basically involves having the athlete do a drop jump off a box about 12 inches in height, and you're going to jump and land into an area 12 inches or 30 centimeters away from the box. And what we do is we score different aspects of their landing based on a 0 to 1 scale, where 0 represents a good movement pattern, which is considered low risk, and 1 is a high risk movement pattern or poor mechanics. It has been shown to have a high level agreement with the original test, and there's a research article citation if you'd like. So basically it's just a drop jump landing, and the athlete goes right up into immediately a vertical jump. I'll go through kind of the breakdown here. The first thing we look at is when the athlete first makes contact with the ground, do the knees stay aligned over the toes as you see in that first picture there, or do they kind of buckle in? Do they drop in into what we call a valgus moment, which means the knee drifts inward relative to the hip and foot position? Second thing we look at is as the athlete absorbs force and goes down into that squatting motion, does the knee buckle inward or does it stay aligned? In the bottom picture, you can see the right side, the knee is kind of inward relative to the foot, whereas his left side is pretty well aligned. From the side view, we can kind of see how the knee flexion angle is. A lot of athletes will land really stiff-legged to where their knee is kind of more straight, and that predisposes them to kind of going into a buckling backwards or a hyperextension type of issue that can cause injury risk. So we like to see a little slight bend, maybe 30 degrees flexion at that initial contact, and then in the lower picture, as they absorb the force, we want them to bend into another 30 degrees of flexion. The final thing we'll assess is, do they make a loud sound upon landing, or do they have a nice soft landing sound indicating that they absorb the force very well and more safely? This is an article that came out from the Journal of Athletic Training that looked at, after ACL reconstructions, how differently patients land. We do see a lot more errors in that landing error scoring system, and we specifically see them want to shift weight away from that surgery side to where they either lean the trunk away. And then in the clinic, what we kind of wonder is it a quad weakness that still persists? Do they have some kind of neuromuscular control? Is it a hip or core issue? So that's where, if we see this as a motor control deficit, we'll kind of do some additional testing and see if we can understand why they're actually landing that way. This is another test we can kind of use to see how they move side to side. It's called a lateral leap and catch. We're just going to ask them to bound back and forth over a couple lines. And we make sure they can keep up with a metronome. And we can also look to make sure they're having equal knee flexion angles side to side. We'll basically videotape them and look at how they're landing on one side compared to the other. Especially in our post-op patients, we see them very typically not want to bend their knee as much, meaning they're either not as strong or not as confident in using that knee. We'll now move on to the strength section. As we saw in earlier slides, strength component is really important to having a good neuromuscular injury prevention program. We use various exercises to throw in here. We can use squats, whether it's a single leg squat, double leg squat, or squatting on an unstable surface. We always want to monitor the athlete's motor control. So sometimes giving them a little cue, such as a line on the field, they need to bend their knee, working on keeping it in line. If you want to get fancy, you can even use a laser pointer. They make commercial devices that you can strap to the athlete's leg to hold a laser pointer, just to make sure they're not drifting inward and outward. Plank progressions are typically included in a lot of the injury prevention programs. We can start off with a simple front plank, as we see in the upper left. We can add a hip extension, or we can add some side plank, as you see in those bottom two slides. Bridges are a great exercise to train the hamstring and the glutes. Single leg, double leg, or if you want to add a bridge on an unstable surface, such as a soccer ball or a foam roll, really will up the hamstring demand. We see a lot of lunge progressions used in injury prevention programs. You can do a simple walk across the field and lunge. You can add some rotation, or you can add kind of an overhead reach and up to the side. Nordic hamstring curls are another good thing to add. They have a great track record of minimizing our risk for hamstring injuries, as well as they are protective of the ACL. If your athlete can't do a Nordic hamstring as demonstrated in that top, they can use their arms to help them roll out on a physio ball. We'll now move into some of the plyometric, the jump landing training. We can start off just with something simple, such as single leg jumps or double leg jumps. You can see in the video here, he's landing nice and soft. He's not letting his knees buckle into any kind of a valgus moment. We can do a line jump, just kind of back and forth, nice light jump over the line. We see in the second video here, the athlete has a little more trouble controlling that, and you can see those knees kind of want to drift in and almost touch each other as the landing kind of force absorption happens. So if you had a group of athletes lined up on a line, you could really easily pick out the people on your team that are having a little bit more of a trouble with motor control, and hopefully give them some interventions to clean that up. This is a demo of a scissor jump. It's basically jumping up in the air and switching your legs as you land. You're going to land in basically a split squat position. Very good to warm up. Also a good way to assess who has good motor control and who does not. This is a 90-degree jump. It's very typical to have our landing position change. Think about going up for a header in soccer. Maybe you're getting hit in the air. So it's good to be able to adjust your landing and making sure you're still using good mechanics, even though there's some variability in that task. This is a couple of slides on a bound. A bound is defined as one leg takeoff and you're landing on your opposite side. So you're going to look for a good force absorption. You want to see some bend of the knee and of the hip, and again, control that landing. Second slide here is just incorporating an uneven or unstable surface like a Bosu ball and seeing how well they can control that landing. This is pretty advanced and pretty challenging, so we'd want to make sure the athlete demonstrates good form in some lower level tasks before we add anything higher than that. We like to do a lot of lateral bounding to make sure they can move side to side well. First video is just some back and forth. And then once they've shown good form on that, you can get a little more advanced, have them use a sport cord. He's basically tethered to one side and he's having to use some extra force to jump out with that sport cord. And then also when he sticks that landing, the sport cord's trying to pull him back inward. So he shows pretty nice form there. If you want to get fancy, if your athletes are starting to look good, you can add 2 hops into a bound. This is really a challenging exercise, and I would only probably add this in some athletes who need a little extra challenge. And by the same token, we can do the same thing laterally, 2 hops to the side, and then a nice bound to the side. Now we'll move on and talk a little bit about change of direction and agility training. As we talked about before, a lot of these athletes get hurt in different types of movements, change of direction, cutting, pivoting, twisting. So we want to encourage them to keep some basic concepts in mind. And I'll ask you to keep these in mind as we see some of the subsequent videos. We always want to make sure the athlete is lowering their center of gravity when they change direction, and you want to get a lean in the direction you want to go. So we'll give some cues like nose over the toes, keeping the shin angles parallel, and then you want to lean in the direction you want to go. So this is a front to back direction change, just running forward and backwards, making sure they have that forward trunk lean and pushing off smoothly and coming back. We can see in the second video here, we will often see the athlete just kind of stab at the ground and not really focus on keeping that knee tracking properly over the toes. This lets that knee drift in and creates a big injury risk. So sometimes we'll add an external focus cue, maybe a cone, maybe asking them to keep their knee in alignment with a stripe on the field or something like that, just making sure that knee is drifting forward over the toes and not buckling inward. For athletes that really struggle with this, you can add a strength component to this. This is showing a sport cord trying to pull the athlete's knee inward. His job is to push his knee outward and keep it tracking right over his toe. So this is really good for some athletes that struggle with this or might have a lot of hip weakness. This just shows some change of direction laterally, and you can see how he's leaning in the direction he wants to go, and then keeping his shins in parallel. Sorry if that video is a little jumpy. This is a diagonal bound. We're just going to ask him to drift sideways, absorb that force nice and soft, keep a nice knee flexion angle, and this will prepare us for the next item we'll work on, which is a 45-degree change of direction. So this is a really good research study. They looked at asking the athletes to sprint forward to a force plate, and then they were asked to make a 45-degree angle cut, either to the right or left. They were first asked to do this with their normal cutting technique, then with 9 different types of cutting techniques they threw in as kind of part of the experiment. We won't go over these in general, but basically what the study found was the techniques that put the most stress on the knee, i.e. leading to increased injury risk, were what you see in the first slide. We're basically asking him to cut to his left, and you can see he has a big body lean away from the direction he's wanting to cut. And the second one, he's cutting to his left, and you can see how wide from that center position his plant leg, his right leg, is. Both of these put a lot of extra stress on the knee. So what we want to teach people to do is what's called a whole body sidestep cutting technique. And this is really going to reduce the peak forces that are on the knee. So as you can see, if the red line is his center position, his foot is not placed too far from that line, and he has a nice body lean in towards the direction he wants to cut. If we could teach our athletes to cut more consistently like this, they would be much less likely to be injured, and it would put a lot less stress on the knees. And they would be faster eventually as well. So I'll just show a couple drills of some things we can put some of these exercises together. This is we're just asking him to go to a sprint, and then he's going to immediately go into a side shuffle. So it just kind of helps mix things up, see how he thinks on his feet, see how he moves. And if we're wanting to identify some problems, we can slow this down and have him watch it back in slow speed. This is a T drill. He's being asked to sprint up to a center cone, shuffle to each side, and then immediately go into a back pedal. If you want to make this a little less predictable, you can give him hand signals to which side he wants to cut to. A lot of times I'll throw a ball and make the athlete cut to the side and catch the ball and return it back to me. So a lot of things you can do to make this a little more unpredictable and a little more challenging. This is the lower extremity functional run test. We use this a lot with our ACL patients. The athlete's asked to sprint, back pedal, go into a shuffle, then into a karaoke, and then finally sprint through the line. They're going to do this over a 10-yard distance, and we do this for time. We like the males to be 18 to 22 seconds, females 20 to 24 seconds. So we're looking for good form and also that they're fast enough to hit that cutoff score. So I'll kind of finish things up by talking a little bit about footwear. We get a lot of questions about this, and you really need to talk to your athletes about what type of surface they're playing on, especially for our field athletes thinking about football, lacrosse, and especially soccer. A lot of our athletes are playing on what they call turf, but it's really artificial grass. There's really not a lot of the old school AstroTurf anymore from the 70s and 80s. So we really want to look for shoes for the right playing surface. So if you look for a cleat that's AG, That's the modern type of artificial grass that we see on most of our all-weather fields. There's an MG that's basically a hybrid between the AG and the FG, which is firm ground. And then finally, SG is soft ground. So depending on what you're playing, and you may have to have a couple different shoes based on what type of surface you might be on, but it's important to match that to minimize your injury risk. And I think it goes without saying that we should be in the proper size, footwear, and then the materials don't last quite as long as we'd like to think. So if we do see signs of excessive wear or breakdown, we do need to switch those out. This was a pretty cool study that came out in the American Journal of Engineering and Applied Sciences, and they looked at a lot of different footwear and did a lot of stress testing on different surfaces. And they find that if we are on that artificial grass surface, wearing a round cleat or a turf type of shoe is really the best. It'll still provide adequate traction, but when we get to a really maximum torque type of situation, it still will have some give so that all that stress doesn't get revisited to the knee or the ankle. These are just some examples of AG cleats. We're typically going to see something that's a little bit shorter and rounded or conical studs. We want to look for a little higher number of studs on the foot plate of the shoe. We want them evenly distributed, and we want them symmetrical in height. So we kind of contrast this with more of a firm ground or a soft ground shoe. This is where we see the bladed cleats and maybe some of those deeper cleats that we need when the ground is muddy, but we certainly don't want to wear a turf shoe, a firm ground or a soft ground shoe on a turf situation where we might not need that much traction. We see a lot of athletes getting in there, feel like they get their foot caught in the turf or it doesn't give way, and that's when they twist that knee. There's a lot of research out there. Obviously, everybody's trying to capitalize on this. There are cleats coming out designed specifically for the female athlete, which is a really interesting avenue to take. There's also some shoes with smart studs that they say has a little bit of small movement in the stud, so it will give adequate traction, but still allow that cleat to release a little bit so the force doesn't go to the knee. So keep your eyes out as research comes out on this. And then I've included a website down at the bottom that has a lot of different options for some of those artificial grass cleats that can be hard to find in local stores. So I'll just wrap it up with a few take-home points. First, it's really important to reinforce compliance. The best program in the world isn't going to be helpful unless it's done consistently. Some of the research shows that giving the athletes responsibility for this on their own, maybe team captains or team leaders can take control of this, and sometimes that does help it get done more consistently. Often the coaches have a lot on their plate. They're trying to secure field space, talking with the refs, especially before games. So if the athletes can take this upon themselves, I think it's really helpful. Starting them young is super important. It's a lot easier for the athletes to develop good movement patterns before puberty. Once they get older, once these movement patterns are set in, it's really hard to make a change. And it's certainly hard for us to do it in the medical community after they're already coming off an injury. So the earlier, the better. And finally, it's really important to incorporate video analysis and some cueing that can really help the athletes in their motor learning. A lot of times the athlete will get preached to on the same thing over and over by different coaches and different trainers. And once they see it slow motion in video, they're like, oh, wow, I really understand what my coach was telling me now. So whether it's a mirror, whether it's a cell phone, whether it's an iPad, anything just to get them a little feedback can make a huge, huge difference. So I really appreciate everybody's attention today. We'll move on to some question and answer. Doing this about 25 years, and not necessarily in the short term, but probably in the last 10 or 15 years, we've seen a big influx of the female athletes getting injured. I think it's definitely great. The more girls are getting involved in sports, more girls are getting involved in different types of sports with some of the changes in college athletics. But we do see a lot of more injuries in the female athletes. I think early on in my career, I saw a lot more male athletes with more of the traumatic injuries, football, rugby, things like that. But now we see a lot more female athletes and a lot of soccer injuries.
Next question is turf or artificial grass really less safe than a natural grass playing surface?
Yeah, that's a tough question. A lot of times the athletes don't have a lot of choice on what they play, so it's hard to beat that drum too hard. I will say this, the best surface and the surface athletes like the most is really going to be a well-maintained natural grass surface. Now, for our recreational athletes or high school athletes, that's not always available, especially when you travel to a school outside of our area. We see a lot of grass surfaces, but if it's really hard, if it's not well maintained, if there's holes in it, that grass surface may not be, quite as nice as the pro teams are playing on. So grass surface is the best, but some of the modern turf is actually getting better, and there's a lot of research out there involved. So my suggestion is make sure you have the right type of cleats for the surface you're playing on.
Next question is early sports specialization leading to increased injury rates in kids?
Yeah, that's another controversial topic. I think the athletes are under a lot of pressure to be really good at a younger age. It's super competitive. A lot of kids feel like if they don't specialize early, they're not going to be able to make their middle school or high school team. In the big picture, it's really nice to encourage the kids as much as possible to try as many sports as they can. It leads to a much more well-rounded athlete. It minimizes the injury risks. It allows them to think outside the box. And it does afford them, if they do get an injury in one sport, at least they've tried some other sports and can move on to another sport. If they specialized only in lacrosse from the time they were 4 years old and something happens that they can't pursue lacrosse, they're really not able to switch gears. But for whatever reason, it is really a big issue, that early sports specialization. I think it goes a lot with just how society has changed over the years. Kids don't play outside as much, so a lot of things are structured and organized. So we do get that early sports specialization. So I encourage my kids to take some time off during the off season, try another sport, and maybe just give yourself a little break so you're not getting ground down and exposed to the same injury mechanisms.
Are there specific sports where ACL prevention programs are more critical?
I think it's important for all sports. I will say that soccer is probably the biggest one. If you look at all the research, a lot of these are geared around soccer. And I think a big part of that is because girls play so much soccer at a really high rate. I mean, football and other sports such as that have a lot of high injury risk, but we don't have as many girls playing football as we have soccer. So I would really say soccer is one of the biggest ones. And it's not to vilify soccer as a bad sport or dangerous sport. It's just a lot of people play soccer.
How often have you seen non-athletes re-tear their ACL?
Honestly, the re-tear of the ACL is pretty low in a non-athlete. So a lot of times, sometimes people will get in a situation where it's later in their career. Maybe they don't want to go back to the high level of sport that involves cutting and pivoting, twisting. So if you have an ACL reconstruction, if you follow the doctor's order, if you get fit, if you just want to be a gym warrior, do non-impact stuff, maybe some jogging, lifting weights, things like that, it's a very, very low risk of you re-tearing your ACL again.
Is core strength important in ACL prevention?
It definitely is. We saw a few slides on the planks and some of those various other types of hip strengthening exercise. So core strength is really, really important. I think it's important that you include a broad-based injury prevention program as well, because we can't negate the quad, the hamstring, some of the lower leg as well. But yes, you definitely want to include a lot of core strength in your program.
Is there a certain age where ACL prevention is the most helpful?
That's kind of a tricky one. We see most of the ACL injuries as they start getting into puberty. So again, we don't see many elementary school athletes and seldom do we see early middle school athletes with the ACL. It's usually when they get into puberty, their body starts growing. You think of the kid that has grown 6 inches and put on 30 pounds of muscle mass in the last couple of years. So in that regard, I would say around the time of puberty and past, that is the most crucial. But if you remember the previous slide where we really need to train those motor patterns earlier, the earlier the better. So in the big picture, start them as young as you can and get good movement patterns from the very start, and it'll pay a lot of dividends down the road.
What role does fatigue play in ACL injury risk and prevention?
Yeah, anytime, if you've trained hard, those legs kind of get jello-y and tired at the end of the workout or the end of a game. So injury prevention does need to key in on identifying the athletes that are looking tired or slow on the field. Anytime anybody goes back after an injury, we always try to communicate with the coaches and the trainers and say, listen, you might not want to come off the field, but I want the trainer to keep an eye on you. If they see you hesitating, guarding, not using good movement patterns, you do need to come off as you get tired. Another thing we see as the athlete fatigues, especially with the quad, they kind of play high to where they don't get low, drop their center of gravity. And that's really a problem where we see a lot of hyperextension injuries and some of those valgus injuries where the athlete's knee will kind of buckle inward.
What is the research on re-injury of the same knee or the other knee?
Yeah, it's pretty interesting. This always kind of goes back and forth in the literature, but a lot of the studies you'll look at, if you go back, you're almost as likely to re-injure the opposite knee as you are to re-injure your ACL knee again. So depending on how you look at it, that could be a good or bad thing. We don't want the athlete to injure either knee. A lot of that happens is because sometimes the ACL reconstructed knee might still be a little weak, and the athlete may dispose themselves by overusing that non-injured leg. So every time we do these videos, every time we do the tests, we'll look at both sides and make sure the athlete is using each leg equally, because we don't want them injuring either one. And it's also important in late stage rehab to really make sure you're training both legs equally. We do have some athletes that'll come in and they say, well, I've only been training my surgery leg because I want it to catch up to the other one. That's really not good thinking. You want to train each one equally so both legs become equally strong. If you only train your injured leg, you'll get symmetry much faster, but you'll be symmetrically weak, and you need to really hit both of them hard.
Is there any new data regarding female hormone cycles in adolescent instances of ACL tears?
This is really ongoing. It's often really, really hard to say because the athlete is going to want to play through their sports season. They're not going to ask the coach to stay out during certain times, of their cycle. It's a touchy subject, but it is something I think we need to be mindful of. So I think if you're a high risk athlete, maybe you do have some movement pattern issues, maybe you've had a history of injury. I think it's great to sit down with your coach, your trainer, maybe your medical team as well, to say, hey, you know what, if there is certain times, maybe around the cycle that you're predisposed, especially if you're not feeling good. A lot of times athletes will play in games where they don't feel 100%. Maybe they're dehydrated, maybe they're tired, maybe they haven't slept well. Those are the times we injure ourselves as well. So I think having an open dialogue with the coach and hoping that you can maybe change your game schedule a little bit will really make a difference in that area. There is some research that talk about, birth control pills and things like that. Does that blend out and kind of modify your hormonal spikes? I think that's, emerging research, and that's something that the athlete would have to talk more about with their family doctor as well. All right. So that wraps it up. I really appreciate everybody's questions and attention today. A replay of this will be available on all of our social media platforms. If you have any more questions or have any questions about your current symptoms, please check us out on our HURT app. You can download that and submit questions directly through there. And I'd like to thank everyone and wish you all a good night.